about these standards of proficiency, how proficient you are, apply to all NMC registered nurses. They should be read with realizing professionalism. So whatever standards you are reading, you should read it so that you can be professional and realizing the professionalism, how important this task are for our professions. Standards for education and training, which sets out our expectation regarding delivery of all pre-registration and post-registration NMC approved nursing and midwifery education programs. So these standards, not only after registration or when you're working with UK or in UK, only that time it is not involved, but also these standards start from pre-registration, like before you start registering yourself in NMC. From there onwards till you're working with NMC, then if you take a gap, then again if you join NMC. So these standards are applicable to everyone who are planning to join NMC or who have joined NMC. These standards apply to all approved education providers and are set out in 3 parts. Even as I told you, these NMC standards are for nurses, midwives, then nursing associates, the educators, the organizations who are giving education to the future nurses. It is applicable to them too. So these standards apply to them all. Part 1, Standards Framework for Nursing and Midwifery Education. What is the framework? What are the features? Standards for student supervision and assessment. So in the first standard, what are the how should be the education of a nurse? Second is, how are we going to supervise the student and their assessment? Third is program standards, which are standards specific for each pre-registration and post-registration program. Yeah, so pre and post registration. So if you are registering yourself with NMC, what should be your pre, and after registering yourself, what should be the standards? Everything. Education institution must comply with our standards to be approved to run any NMC approved program. The education institutes also should work according to NMC standards if they are going to run any NMC programs. Together, these standards aim to provide approved education institutions and their practice learning partners with flexibility to develop innovative approaches to education for nurses and midwives while being accountable for the local delivery and management of approved programs in line with our standards. These all standards, they help individual as a nurse, or it helps in a team. It also helps to organizations who are going to deliver knowledge to students, who are going to help the society in turn in terms of nurses or delivering care. Number 1, legislative framework. Legislative framework, Article Section 15, subsection 1 of the Nursing and Midwifery Order 2001. The order requires the Council to establish standards for education and training which are necessary to achieve the standards of proficiency for admission to register as required by Article Section 5, subsection 2 of the order. The standards for nursing and midwifery education providers are established under the provision of Article Section 15 subsection 1 of the Order. Article Section 5 subsection 2 of the Nursing and Midwifery Order 2001 requires the NMC to establish standards of proficiency necessary to be admitted to each part of the register and for safe and effective practice under the part of the register. These standards of proficiency have been established under this provision. So in this section 15(1) and in section 5 subsection 2 of the order, here it is told that the NMC, it should make such framework for the admission of the new nurses who are going to get registered in NMC. So what should be their standards? All this should be reviewed and regulated and made by NMC. Now here we start with the main platforms. Okay, we have 7 platforms. The first one is being an accountable professional. So whatever actions are taken by us, we should be accountable for them. We should take responsibility of our actions. That is a platform 1. Second is promoting health and preventing ill health. We ourselves should be in such a condition health-wise that we should be able to promote health and we should be able to prevent ill health. Before anything happens, we should be able to prevent it. Number 3 is assessing needs and planning care. We should be able to recognize the needs of the patients and accordingly plan what care or what treatment we are going to give to them. Number 4 is providing and evaluating care. So once you decide what care you are going to give, you should be able to provide it and you should be able to evaluate it. Yeah, is that care going properly? We should keep a check on it. We should be able to check whether the patient's condition is not deteriorating, but it is getting better and better. Number 5th platform is leading and managing nursing care and working in teams. We should be able to work in any setting, whether that's an autonomous or whether it is in a group or a team. Improving safety and quality of care. Whatever care we give, it should be quality. It should be proper. We should be able to improve the safety. Then 7th platform is coordinating care. So whatever care we do or we take care of the patient, we should be able to coordinate it in a proper manner. So what exactly we do in all these 7 platforms, we are going to see one by one. Here the heading tells you Future Nurse Standards of Proficiency for Registered Nurses. Now proficiency means what should be their standard, how skilled they should be, what knowledge they should possess, and how proficient they should be. That is how capable they should be as a registered nurse. All these things we are going to see in the coming slides. How the proficiencies have been structured. So how the capabilities, what skill they need, how it is structured according to these standards. The proficiencies are grouped under 7 platforms. So what capabilities they need or what skills they need, it is divided into 7 platforms here, followed by 2 annexes. Together these reflect what we expect a newly registered nurse to know and be capable of doing safely and proficiently at the start of their career. These standards, as I told you, it is helpful for the future nurses, for the new nurses, so that they can work appropriately. They should know what we expect from them and what they should be doing so that they work appropriately, at the starting of their career. Key components of the roles, responsibilities and accountabilities of registered nurses are described under each of the 7 platforms. What is the main motto, the main role, their main responsibility, what are they responsible for? Everything in detail is given under these 7 platforms. We believe that this approach provides clarity to the public and the professions working about the core knowledge and skills that they can expect every registered nurses to demonstrate. So these standards what NMC makes, these platforms, they give us a clear idea that what a public also can expect from the nurses. These proficiencies will provide new graduates into the profession with the knowledge and skills they need at the time or at the point of registration, which they will build upon as they gain experience in practice and fulfill their professional responsibility to continuously update their knowledge and skills. So these platforms, they will also help the new nurses, whoever is going to join as a registered nurse, they'll come to know what they need, and while doing their services or while taking care of people, they will try improvising, they will try inculcating knowledge timely. For example, after they register with us as a registered nurses, will already be equipped to progress to completion of prescribing qualification. The outcome statements for each platform have been designed to apply across all 4 fields of nursing practice, that is adult, children, learning disabilities and mental health. Now, as the nursing care is divided into 4 things over here, the how to provide adult care to the elderly, to children, those are toddlers or the age group according to children, learning disabilities, if any person is vulnerable, have learning disabilities, or mental health, and all care settings and other care settings also. So these platforms, they are useful to everyone. This is because registered nurses must be able to meet person-centered, holistic care needs of the people they encounter in their practice, who may be at any stage of life and who may have a range of mental, physical, cognitive or behavior health challenges. So these platforms, they are designed for every care setting, they mean to say here. Whoever the patient is, whatever the patient needs, whatever kind of care the patient needs, this platform is designed accordingly. They must also be able to demonstrate a greater depth of knowledge and the additional more advanced skills required to meet the specific care needs of people in the chosen fields of nursing practice. So the nurses, the team should be able to provide the advanced care skill. The annexes to these standards of proficiency are presented in the 2 sections. The annexes provide a description of what registered nurses should be able to demonstrate they can do at the point of registration in order to provide safe nursing care. So these were the 7 platforms they were talking about, and now they're talking about the annexes. So what the annexes include? It includes that before getting into UK registration or NMC register, you should possess few qualities, skills. So what are those? Those are mentioned in Annex A and B. In Annex B specifies the nursing procedures that registered nurse must demonstrate that they are able to perform safely. So in A, what skills they need. In B, how they can perform those skills properly is mentioned. As with the knowledge proficiencies, the annexes also identify where more advanced skills are required by registered nurses working in a particular field of nursing practice. This annexes also demonstrates, but it also helps in checking whether these nurses have those skills, and if they don't, then how they can be trained working in a particular field. So let's go. The next part of the content is in the further video. Please do watch it. You can see the link description in the description of this particular video also. This content belongs to NMC. I'm just explaining the points so that you all can do the self-study. We are taking effort to make all these things for y'all. So please y'all also make an effort to like and press the bell icon and comment if you really liked it.